Hello, everyone. I'm Dr. Alan Mandell, and welcome back to Healthy Aging America, the channel dedicated to helping you live a healthier, more active life at every age. Today, I want to talk directly to anyone who has been dealing with knee pain. Maybe it starts the moment you get out of bed in the morning. Maybe it flares up when you climb a flight of stairs, or when you try to stand up from your favorite chair. Maybe your doctor has mentioned the word surgery, and that word has been sitting heavily in the back of your mind ever since. I want you to hear this clearly. Surgery is not your only option. For the vast majority of people over the age of 60 who suffer from knee pain, whether it's from osteoarthritis, overuse, cartilage thinning, or general degeneration, there is a proven, natural, and highly effective alternative, and it begins with strengthening the muscles that surround and support your knee joint. Today I'm going to share with you 5 exercises that I recommend to my own patients. Exercises that reduce pain, restore mobility, and give your knees the structural support they need to function properly. These are safe, low impact, and you can do every single one of them right at home. Stay with me through this entire video because exercise number 5 is the one that most people overlook, and in my experience, it may be the single most important movement for long-term knee health after 60. Let's get started. Before we jump into the exercises, I want to take just a few minutes to explain why this happens, because once you understand the mechanism, the exercises will make much more sense. Your knee is one of the largest and most complex joints in the human body. It's a hinge joint supported on all sides by ligaments, tendons, cartilage, and, most importantly for our purposes today, muscles. As we age, several things begin to happen inside and around the knee. The articular cartilage, the smooth cushioning tissue that covers the ends of your thigh bone and shin bone, gradually thins out. This is a completely natural part of aging, accelerated in some people by excess body weight, previous injury, or a lifetime of high-impact activity. At the same time, most people over 60 experience a condition called sarcopenia, the gradual loss of muscle mass that begins as early as our 30s and accelerates significantly after 60. The quadriceps muscles at the front of your thigh and the hamstrings at the back are the primary dynamic stabilizers of the knee. When these muscles weaken, your knee joint is forced to absorb forces and loads it was never designed to handle on its own. Think of it this way. Your muscles are the shock absorbers. When the shock absorbers wear out, every bump in the road goes straight to the frame. In this case, the frame is your knee joint, and that is when pain, inflammation, and progressive degeneration begin. Here's the good news. Muscle loss is reversible. Research published in leading orthopedic and geriatric medicine journals consistently shows that targeted resistance training can rebuild muscle strength at any age, including in your 70s, 80s, and beyond. And when the muscles surrounding the knee are strong and well coordinated, pain levels drop dramatically. That is the foundation of everything I'm going to show you today. Our first exercise is the straight leg raise, and I love starting with this one for a very specific reason. It powerfully activates and strengthens your quadriceps muscles, the most important muscle group for knee stability, while placing absolutely zero compression on the knee joint itself. This is the exact same exercise used in post-operative rehabilitation after knee replacement surgery.
If it's safe enough for someone who just had their knee opened, it is absolutely safe for you. Here's how to do it.
Start by lying flat on your back on a firm surface. A yoga mat on the floor works perfectly. Bend your left knee so that your left foot is flat on the floor. Your right leg should be straight out in front of you. Now, tighten the muscles in your right thigh. Specifically, you're going to contract your quadriceps. Think about pulling your kneecap up toward your hip. You should feel the entire front of your thigh engage. Keeping that contraction, slowly lift your right leg off the floor until your foot is approximately level with your bent left knee, roughly 12 to 18 inches off the ground. Hold for 2 full seconds at the top. Then slowly, and I want to emphasize slowly, lower your leg back to the floor. That is 1 repetition. The goal is to complete 3 sets of 12 to 15 repetitions on each leg. Rest for about 30 to 45 seconds between sets.
Now, the most common mistake I see with this exercise is letting the low back arch off the floor as the leg comes up. If that's happening, it means your core is not engaged. Before you lift, press your lower back gently into the mat, tighten your abdominals slightly, and then perform the movement. That small adjustment makes a significant difference. If this feels too easy after a couple of weeks, good. That means you're getting stronger. You can add an ankle weight of 1 to 2 pounds to increase the challenge. Remember, slow, controlled movement is the key. Momentum is your enemy here. Muscle engagement is your goal. Exercise number 2 is the modified wall sit, and this is one of the most powerful tools in our toolbox for building knee stability without impact.
A wall sit is an isometric exercise, meaning your muscles are working hard and under significant load, but the joint itself is not moving. This is ideal for people who experience pain with movement because you get all of the strengthening benefit without the mechanical stress of a full range of motion exercise. Here's how to perform the modified version that is appropriate for seniors and anyone with current knee discomfort. Stand with your back flat against a wall. Step your feet out in front of you approximately 18 to 24 inches. Your feet should be shoulder width apart and pointing straight forward. Now, slowly slide your back down the wall by bending your knees. I want you to stop at a position where your knees are at roughly a 100 to 110 degree angle. In other words, you're in a very shallow seated position. Your thighs should be angled downward, not parallel to the floor. This is the modified version, and it is far safer and more comfortable for people with knee pain than a full 90-degree wall sit. At this position, squeeze your quadriceps and glutes and hold. For beginners, aim to hold this position for 15 to 20 seconds. As you get stronger over the following weeks, work up to holds of 30, 45, and eventually 60 seconds. Complete 3 sets with about 30 seconds of rest between each hold. One important note: during this exercise, make sure your knees are tracking directly over your second and third toes, never caving inward. If you feel your knees wanting to drift toward each other, place a small pillow or folded towel between your knees and gently squeeze it. This cue alone will activate your inner thigh and glute muscles and protect your knee alignment. If you are nervous about lowering down or getting back up, position a sturdy chair directly in front of you so you can use it for support. Safety always comes first. Exercise number 3 is a seated knee extension using a resistance band, and this one targets a very specific and critically important muscle called the vastus medialis oblique. Most people just call it the VMO. The VMO is the teardrop-shaped muscle you can see on the inner side of your quad, just above the kneecap. Its job is to guide the kneecap in its groove as your knee bends and straightens. When the VMO is weak, as it is in the majority of people who experience knee pain, the kneecap tracks slightly off-center. Over time, this creates friction, inflammation, and the specific type of aching pain around and beneath the kneecap called patellofemoral pain syndrome. Strengthening the VMO is one of the most direct, evidence-based interventions for this common and frustrating condition. For this exercise, you'll need a simple resistance band. The flat loop style works best, but any resistance band will do. If you don't have one, you can still do this exercise without it and get benefit, though the resistance band significantly increases the effectiveness. Sit in a sturdy chair with your back straight and your feet flat on the floor. If you have a resistance band, loop it around both ankles. Slowly extend your right knee, straightening your leg out in front of you. As you extend, rotate your foot very slightly outward, about 10 to 15 degrees. This small external rotation maximizes VMO recruitment, which is exactly what we want. Hold the fully extended position for 2 seconds and really squeeze the quad at the top. Then slowly lower your foot back to the floor. Take about 3 full seconds on the way down. Controlled lowering, called an eccentric contraction, builds more muscle strength than the lifting phase alone. Perform 3 sets of 12 repetitions on each leg. If the exercise feels too easy with your current band, move to a slightly heavier resistance. If you feel pain at any point, stop and check your range of motion. You may only need to extend part way to stay within a comfortable, pain-free range. That is perfectly acceptable. Always work within your pain-free range, and your strength will build from there. Exercise number 4 is the calf raise, and while it may seem like an unusual choice for a knee pain video, the science behind this one is fascinating and highly relevant. Here's why this matters. When you walk, your calf muscles, specifically the gastrocnemius and soleus, work in coordination with the Achilles tendon to absorb and distribute ground reaction forces as your foot strikes the ground. When your calf complex is strong and elastic, it absorbs a significant portion of that impact energy. When it's weak, that force travels up the leg and is absorbed disproportionately at the knee. Research has shown that strengthening the calf-Achilles chain can reduce compressive forces at the knee during walking by a meaningful amount. For someone who takes thousands of steps per day, that adds up to significant relief. There's an added benefit for our older viewers. Calf raises also pump venous blood back up from the lower legs toward the heart. This reduces swelling, improves circulation, and helps prevent the heavy, achy feeling many seniors experience in their lower legs and ankles by the end of the day. Here's how to perform the standing version. Stand behind a sturdy chair or at a kitchen counter. Hold on lightly for balance, not support. Your feet should be hip-width apart. Slowly rise up onto the balls of both feet, lifting your heels as high as you comfortably can. Hold at the top for 1 to 2 seconds. Then slowly lower your heels back to the floor, taking 3 full seconds on the way down. Perform 3 sets of 15 repetitions. If standing is uncomfortable, you can do an equally effective seated calf raise from a chair. Sit up straight, feet flat on the floor,
Simply raise your heels off the ground by pressing through the balls of your feet, hold, and lower. The movement is identical, only the position changes. You can even add a small weight on your thighs to increase the resistance in the seated version. One tip: don't rush through these. A slow, full-range calf raise done with intention is worth far more than 20 fast, bouncy repetitions. And now we arrive at exercise number 5, and I promised you at the beginning of this video that I was saving the most important one for last. Here it is, the glute bridge. I want to ask you something. When you think about knee pain, do you think about your glutes? I'm guessing the answer is no, and that is exactly the problem.
Your gluteus maximus, the large, powerful muscle that makes up most of your buttock, plays a foundational role in knee health. Here's how. The glute max controls the position of your femur, your thigh bone, as you move. When the glutes are weak, the femur tends to rotate inward and the knee drops toward the midline, a position called knee valgus or knock knee. Under load, walking, climbing stairs, standing up from a chair, this misalignment creates enormous shearing stress on the inside of the knee joint and on the ligaments that hold it together. Studies in sports medicine and orthopedic rehabilitation have consistently found that weakness in the hip abductors and glutes is one of the most significant contributing factors to knee osteoarthritis progression, patellofemoral pain, and even the development of IT band syndrome. The good news is the glute bridge addresses all of this, and it is performed lying on your back, which makes it completely safe for virtually anyone, regardless of fitness level. Here is how to do it. Lie on your back on a firm, comfortable surface. Bend both knees so your feet are flat on the floor, approximately hip-width apart. Your feet should be close enough to your body that your fingertips can just brush your heels. Let your arms rest at your sides, palms down. Take a breath in. As you exhale, engage your core by drawing your belly button gently toward your spine. Then, press firmly through both heels and squeeze your glutes as hard as you can. Lift your hips off the floor until your body forms a straight, diagonal line from your shoulders to your knees. Think of it as forming a tabletop with your torso. Hold the top position for 2 full seconds, and I want you really squeezing those glutes the entire time. Don't just hold passively, actively contract. You should feel the work clearly in your buttocks and the back of your thighs. Then slowly lower your hips back to the floor. Take 3 seconds on the way down. Do not plop down. Controlled lowering is key. Perform 3 sets of 12 to 15 repetitions. When this feels easy, and it will, faster than you expect, I want you to progress to a single leg glute bridge. The technique is the same, but one foot is lifted off the floor with the knee drawn toward your chest. The single leg version dramatically increases glute activation and adds a stability challenge that carries over directly into walking and stair climbing. Let me be direct. If I could only prescribe one exercise for knee pain in seniors, it would be the glute bridge. Not because it directly works the knee, but because it corrects the upstream mechanical flaw that causes most knee problems in the first place. Strong glutes create aligned, protected, stable knees. It is that straightforward. Now let's talk about how to put this all together into a daily routine you can actually stick with. Here is the sequence I recommend. Start with your straight leg raises, 3 sets of 12 to 15 reps per leg. This warms up the quad and gets blood flowing to the knee without any joint stress. Move into your modified wall sits, 3 holds of 15 to 45 seconds depending on your current level. Next, your seated knee extensions with a resistance band, 3 sets of 12 reps per leg. Really focus on that VMO contraction at the top. Follow with your calf raises, 3 sets of 15 reps, standing or seated, your choice. Finish with your glute bridges, 3 sets of 12 to 15 reps. The entire routine takes approximately 15 to 20 minutes. I recommend doing it once daily, ideally in the morning, before walking or any other physical activity. Think of it as priming your entire lower extremity kinetic chain for the day ahead. Now, one of the most common questions I hear is, how long before I notice a difference? Here is an honest, realistic answer. Most people who are consistent with this routine begin to notice meaningful improvement in their pain levels and mobility within 2 to 4 weeks. For some, it happens faster. For others with more advanced degeneration, it may take 6 to 8 weeks to feel a significant shift. The key word in all of this is consistent. Doing these exercises 2 or 3 times and then stopping will not help you. Daily practice is where the transformation happens. A few important guidelines as you begin. It is normal to feel mild muscle soreness, especially in your quads, glutes, and calves during the first week or two. This is your body adapting and growing stronger. This is a good sign. It is not normal to feel sharp, stabbing, or worsening joint pain during any exercise. If that happens, stop immediately. Reduce your range of motion, lighten any resistance, or skip that exercise and check with your healthcare provider. Never push through true joint pain. If you have had recent knee surgery, a significant injury, or if you are currently managing any acute inflammation or infection in the joint, please consult your doctor or physical therapist before beginning this program. These exercises are appropriate for the vast majority of people dealing with chronic knee pain, but your individual situation matters, and your medical team knows your history best. Let me leave you with this thought. Your body is remarkable. It is designed to heal, adapt, and rebuild at any age. The research is absolutely clear on this. It is never too late to get stronger. It is never too late to reclaim mobility you thought was gone for good. The 5 exercises we covered today are not complicated. They don't require a gym membership, expensive equipment, or a lot of time. What they require is consistency and commitment. Do them every day. Do them with intention, and give your body the time it needs to respond. Exercise 1, straight leg raise, builds quad strength with 0 joint stress. Exercise 2, modified wall sit, builds isometric stability safely. Exercise 3, seated knee extension with band, activates the VMO and protects your kneecap. Exercise 4, calf raise, reduces knee impact and improves circulation. Exercise 5, glute bridge, corrects the root cause of most knee problems by rebuilding hip strength. Do these 5 movements daily, and I genuinely believe you will feel a difference. I'm Dr. Alan Mandell. Thank you so much for spending this time with me today. If this video was helpful to you, please give it a thumbs up. It helps this channel reach more people who need this information. And if you haven't subscribed yet, please do,
because we put out new health and wellness content every single week right here on Healthy Aging America. Leave me a comment below. I read every single one. Tell me, which of these 5 exercises are you going to start with today? And what has been your biggest challenge with knee pain? Take care of yourselves, stay active, and I will see you in the next video.